Hello, everyone. If you've been following my blog or you've been following my daily posts, you know that my mom, she fell last month, and I've been spending a lot of time dealing with her medical issues. And my daughter has also been having medical issues. So I've been spending a lot of time in medical facilities. And this morning, my daughter had an appointment, and we went to a hospital that we don't normally go to. And so while I was in the hospital, like walking through the halls and going to the office that we need to go to, I happened to like start noticing. I don't know why I noticed it this time. I don't know if it's always been this way. I started noticing all these signs in the hospital, like that no violence will be tolerated, no violent words, no etc. So I was like, that's interesting. And there were so many signs. There were so many signs that I was like, man, this is weird. I didn't take a picture of the sign or the signs because I didn't like it was one of those weird things like you notice it, but you're like focus on something else, and I was focused on my daughter. But I made this post. So I made this post this morning, and I said, I'm sitting in this hospital. I've noticed signs everywhere in the halls, waiting rooms, all over, saying there's zero tolerance for violence. And now I'm wondering, are people really cutting up here that often, like enough to need this many signs? Okay, since posting that, and I posted that this morning, it's just a little while ago. It has gotten over 200 replies, and it has brought awareness to me that I didn't have. Our hospital workers, our nurses, our doctors, the people who are administrators are dealing with levels of violence that I don't think we knew. So I'm going to share some of those replies with you. This person said, I've been a nurse since 1997. We have always been assaulted by patients, usually by old, demented folks. COVID changed all of that. It is so very dangerous for us now. Yes, those signs are needed, but don't often enough matter. When patients hit us, the first question we're asked is, what was your approach? What can you do what can you change to avoid this happening again? And like I said, so many replies. I just grabbed a few, just bringing awareness. This lady or this person, I don't know, Crafty RN said, I was punched by a family member while my back is turned while doing a chest PT on his mom. He ran, and the hospital police caught him and was placed in handcuffs to go to jail. I was really shaken by it. This person said, yes, I was in the ER a couple months ago, and there were 3 combative patients who tried to assault the staff in 2 hours. Nurses deserve way more pay. This person wrote, hospital staff are not respected. Every day there are assaults, sexual assaults, verbal abuse, etc., displaced onto them. Just like imbeciles in public of late, they care about nothing and abandon all civility in the face of the accepted MAGA mania. This person said, yes, being a nurse is more dangerous than being a cop. Elaine Baker said, ask a nurse. Yes, I was hospitalized once for leukemia, and a man came on the floor and smashed computers at the desk outside my room and threatened to hurt a nurse. I grabbed my IV pole and hid in the bathroom until they told me it was clear. Trauma informed nurse said, yes, I have been a nurse for 20 years, and it's one of our biggest problems. We have to take combat classes annually. The hospitals won't press charges, so this is how they mitigate violence, by asking you to be nice. It's too expensive for them to care. We are literally just expendable line items. I have been punched by men 3 times my size and had to take care of him for punched by a man, I guess 3 times my size. I had to take care of him for 2 days straight. If I worked at Walmart, I wouldn't have to put up with that kind of stress. And let me see. This person said, I work in a hospital. That automatically means we are likely meeting people on one of the worst days of their lives. And anyone can lose grace in a millisecond when pain and emotions cloud their judgment. And yes, I totally agree with that. Like, I know that, it's an emotionally charged environment. And so totally get that violence can be a factor. What I wasn't aware of is that instead of the hospitals protecting the staff, they're like pushing the staff to de-escalate and mitigate the violence, and that is what's tripping me out. So let me get some more of these comments. All right, Tracy Cozy said the hospital that I just left, which was a smallish community hospital in a relatively low crime area, recently installed a metal detector for the ED. My ex-husband was knocked unconscious by a patient that he was treating in an emergency room 5 years ago. He ended up almost being unable to work in his profession as an RN. And like the metal detectors, I remember when they like added metal detectors at a local ER, and I was like, "What is going on?" But I didn't know it was this bad, you guys. Let's see. Bookstack said a staff member in a hospital near me was shot and killed. The unhinged are routinely taking their frustration with the medical field and health insurance coverage out on the people who can't fix any of it. Um, it like y'all, I'm gonna post in the comment section. I'm gonna put the link to this post that I have on Threads because you guys need to read. You have to read these comments. And like I said, I just grabbed a few. There's over 200 of them. This is a bigger problem, and I don't think enough people are talking about it. That's why I'm making this video. Let's read some more comments. Dave Giamayo or something, I'm mispronouncing it. Try telling someone their child is stabilized, but the care they need for their cancer isn't covered. People pop off, and arguably rightfully so. American spends the most for some of the worst health outcomes, and yet people elect a reality star con man president twice. Jack Topher Abbey says, I'm a retired nurse or RN. I was assaulted several times. So were my coworkers. I know a few nurses who were permanently disabled by violent patients. I left inpatient behavioral health nursing that I really loved because administration cut staffing and made it unsafe for staff and patients. My last day, I was thrown against the wall by a known violent patient. No one was around to help me because no staff. I'm so sorry that happened. Toaster Strudel 905 said, yes. Have you heard a code gray called since you've been there? That means that there's a patient who is escalating. Unfortunately, it's a common problem. Crazy Husky Mom said, I have been hit, pinched, punched, slapped, bit, kicked, spit upon, had my hair pulled, choked, and sexually assaulted. I've had spray adhesive sprayed in my eyes, had my knee kicked out to the point of a torn meniscus. I had my glasses broken 3 times, been stalked, had my car attacked, my credit card stolen twice. Every time administration has asked what could I have done or what I could have done to have prevented it. That's just okay. This Nina Sky said, yes, when you're a cop and you get assaulted, you can hit them back or even shoot them, and there's no repercussion. I think you mean repercussions. But when you are a hospital worker and you get assaulted, you get asked how you could have done things differently to avoid being hit. All right, so that is all I'm going to share from what I grabbed. There are so many more, so I'm going to put a link in the description. You guys go check it out. I feel like we need to bring awareness. Like I said, I've been spending much more time in medical facilities, so this is a whole new thing to me. I'm really saddened to hear that so many hospital workers are being attacked violently, and the administration is kind of making it like their job to fix it. It's not their job. So again, just trying to bring awareness to something. I just learned about it today, and I'm probably not the only person out there who's like, what? They're just attacking you guys and there's nobody talking about this. So that's why I'm making this video. Feel free, like I said, go read the comments for yourself. This is crazy, and I think it's important to share. As always, hit that subscribe button because I talk about all sorts of things. This Saturday, we're going to be doing our live with Kai and Chris in Saratoga. We're going to be talking about a lot of amazingly crazy things, but one of the things we're going to talk about is the Uber driver that was fired for being sexually harassed. We're going to talk about the White House being destroyed and all the other stuff. So make sure you tune in for that. That's going to be Saturday, 12:30 Eastern, 9:30 a.m. Pacific time. Check that out. And yeah, leave your comments here. If you're a medical worker, nurse, doctor, whatever, please share your experience. Let's bring awareness to this because I think this is important. Anyway, as always, peace, guys.